Hello, class. My name is Ofelia Madriga. I am going to be discussing week 2 prompts. So I'll be talking on sexual intimacy satisfaction and the integration of psychological, physiological, and relationship factors. In addition, I'll be talking about the role of a therapist when working with clients whose sexual ability is compromised due to trauma. Well, we're going to start with question number 1. Satisfying sexual intimacy requires an integration of physiological, psychological, and relationship factors for each partner in the relationship. Satisfaction derived from the relationship on every level influence the satisfaction found in the overall sexual interaction between partners. Is this true for everyone? I think there is not black and white answer. There is always going to be those gray areas, and therapists must be conscious about that. Definitely, if the kind of like the mind and body connection is not aligned, it's gonna definitely interact in the relationship that the partner has with each other. So it does play a big role. So we can think about this psychological factor. We can talk about the adverse childhood experiences, the trauma, the stress, having different values, the beliefs, the self-esteem definitely affects how the individual is going to interact with the partner, the level of trust, whether the person is experiencing some sort of depression, anxiety, or overthinking, and that definitely is going to interact with the level of satisfaction that the person is experiencing. Adding to that, we have the physiological factors, which include how the person feels, their physical health, whether they have any chronic illness or they are healthy, their level of fatigue at the time of being intimate, and of course includes the age of the person. That definitely is going to influence in direct interaction when being intimate. In addition to the relationship factors, which include, having commonalities, things in common, things that they enjoy doing together, the friends, the family circle that surrounds them, the lack of commitment among each other, their poor communication styles, whether there is an infidelity or domestic violence involved in the dynamics of the couple. So those 3 factors definitely are gonna influence in the relationship and the satisfaction in the overall sexual interaction. So is it true for everyone? I don't think, as I mentioned, there is not a right answer. However, it is a great potentiality that is going to influence. So question number 2, discuss the role of the therapist in supporting the client in achieving a successful integration of such factors. How may such behavior contribute not only to the enhance of sexual satisfaction, but overall the relationship satisfaction as well? For some reason, these questions are playing games with my brain. Might be confusing to me. So hope I did get the right answer. So the role of the therapist is to work effectively in the sexual trauma field. So they must be very well informed. The therapist also needs to be comfortable and skillful. And when it's talking about the individual in regards to the sexual related. In addition, the therapist must be willing to explore attitudes, experiences, and feelings about the sexual trauma. And that's the case if the person is experiencing trauma. So it is integrating the psychological factor, but also we do have the physiological factors in which the physical health of the client plays a big role, and the age of the client. So the therapist must be aware of these 3 factors, and so they can help to contribute to enhance the sexual satisfaction among the couple. So the therapist must be curious and be able to identify the psychological and physiological factors that could be potentially influencing in the incremental or the decrease of the sexual satisfaction. Moving forward with question number 3, what steps should be considered in working with clients whose sexual ability or interest is compromised due to challenges such as past sexual trauma and pregnancy disruption? I believe these 2 factors are very crucial, because definitely having past trauma is gonna influence in the quality of sexual life satisfaction among the couple. So one of the first steps, I believe that during the first interview, the therapist must be empathetic and feel put at the level of the client. So they must feel, the therapist must feel empathetic, feel empathy, and use positive regards with the clients and validating their feelings. In addition to that, we can move forward to evaluate the individual as the relationship and identify if there is any medical situation or any sexual factors that can compromise the therapeutic plan. We can also focus on helping them identify what is the sexual problem. As we know, the sexual problem or the problem that the client comes to, usually they come with a problem that is over the surface. So we need to be more curious about and ask questions that will guide us exactly to the root of the problem. So it is important for us to identify if there is any trauma, or how would they describe the problem. So we can also find what is the marital commitment and what is the motivation for them to change, and what is the attitude towards therapy. Because we don't know if the person is actually open for therapy, or they actually feel uncomfortable. So definitely we need to also offer an environment that is healthy for them and where they feel safe to share. So it's important for us as therapists to take that step and share the levels of confidentiality. We also can focus on helping them identify, what is each individual, well, first, if there is any medical help, we also need to get that release information to discuss past treatment with prior doctors. We can assess the process to conduct individual sexual history. So that can be either individual or as a couple if they feel comfortable, but assess the individual sexual history. And then from there, when we're asking those questions, the therapist will move from questions that provoke less anxiety to those questions that are more anxiety provoking. And it is mainly so we can transition the client into being able to open up and share about what the truthful of the problem. In addition to that, when we start asking questions that are less provoking to more provoking questions, the couple usually that will allow us as therapists to explore the family, religion, their education, and what are the cultural influences that might be affecting their their sexual identities or the problem that they experience. We can also explore the client's thoughts, the feeling. So here is where it comes into place, the psychological factors, because we are able through curiosity and active listening, we're able to explore the client's thoughts, the feelings, and how they experience trauma, if they experience trauma. We can learn how to deal with how actually they deal with the problem, whether they keep it as a secret or were able to share it with others. How they incorporated that that problem into the person's sexual self-esteem. We can also explore a range of these issues, including positive and negative experiences with dating, how they met and began their sexual relationship, when was their best and their worst sexual experience, when was it that it occurred, and hopefully they can share details that can give us more information and get us closer to being able to help them by understanding the way they process this information. Towards the end, we can also identify, what is exactly the sexual history that they do have. What are those areas that they might still feel confused? What are those areas that they feel that how the traumatic events affect them negatively? Do they have any guilt? Do they have any negative experiences that are influencing from them to, to not be fully present when they are intimate? So the role of the therapist is also to keep the couple focused and motivated to move through the traumatic process to a successful relationship. This means that the person sees herself as an active survivor, no longer as a victim. So as long as the client or the person continue to see themselves as a victim, it doesn't allow us to move forward in life and take responsibility. So the idea is to move them from survivor to a victim mentality so they can take back the responsibility and the control of their sexuality. Once they take control of their sexuality, they are going to be able to experience desire, arousal, orgasm, and satisfaction, and view sexuality as a voluntary, pleasure-oriented, mutual, and intimate way to express their needs and find pleasure overall. The idea is for the couple to develop the sexuality that is comfortable and functional for both of them. The information that I am sharing at this moment to answer this question is from the book Handbook of Clinical Sexuality for Mental Health Professionals by Levine. Thank you. And thank you for watching.